So this one is an adult patient, and this is kind of in context of what we were talking about earlier with the pediatric patient. Pediatric patients, generally speaking, you get supracondylar fractures, but with adult patients, I would highly recommend you go for that radial head. High yield area, radial head is most likely where people get fractures. It may be because when you fall onto your hand, a lot of the pressure may go through the radius, and as the forces of the fall goes through the radius, the radius gets smaller and smaller as you go along, and then it doesn't have quite the weight distribution it could do. And then it ends up hitting the radial head. So when you zoom in to this radial head, you can actually draw around quite nicely the rest of the cortex. But then there's this sort of, another cortex that pops up there, a bit of overlap, and you kind of draw around like so, like so, like so. And then you can see the sort of step deformity that is sitting over here. Yeah, so yes, exactly right. So someone has said it correctly. So you can actually have what looks like a fracture through that radial neck. But the thing where you have to realize, we're talking about joint effusions. Sometimes you get radial neck fractures that are not going to give you much of a joint effusion because they end up being extracapsular, because you actually get a joint capsule which goes around like so. So if you get a fracture that's a little bit more distal, you won't get much of a joint effusion. But if you go a bit more proximal, you get a joint effusion. So all that stuff about raised posterior fat pad and all that kind of thing will most likely happen in this particular situation, but because this is an intra-articular fracture, but a bit further distally, you may not get that. So very, very important you have a look at the radial neck all the way along and actually have a look at that radial head as well to make sure there's no fractures there. In this particular situation, there is definitely a fracture. Quite important still to have a look at the rest of the bones to make sure there's no other fractures anywhere else. I don't have the lateral view, but in the context of trauma, it is quite important to try and see whether there's a coronoid process fracture as well, because when you get coronoid process fractures, it results in long-term instability of the elbow. And again, I will talk about that and go through more intricacies of elbow fractures as we go through the next few months of doing these teaching sessions. Okay, so this is quite important to be aware of. Hopefully that's answered your question.